Welcome to today's session on developmental disabilities. My name is Judy Steik, and I'm a nursing instructor at Central Wisconsin Center in Madison, Wisconsin. Central Wisconsin Center is a home for people with developmental disabilities. Developmental disabilities means that normal physical and/or mental development did not occur due to birth defects, injury, or illness. Developmental disabilities is a general term that covers many different physical and mental conditions. For example, cerebral palsy is a developmental disability that can occur in mild to severe forms. Developmental disabilities are also caused by autism, spina bifida, hearing impairment, visual impairment, hydrocephalus, and microcephalus. These are only a few of the conditions which can cause developmental disabilities. There are hundreds of known causes of developmental disabilities, as well as many unknown causes. Some developmental disabilities affect physical function, some affect mental function, and some affect both. Persons with mental retardation are developmentally disabled. However, not all people who are developmentally disabled are mentally retarded. Mental retardation is a medical diagnosis. People should not be referred to by a medical diagnosis. People who are mentally retarded are people with developmental disabilities. Most people with developmental disabilities are affected mildly. With early intervention, special education, and community living support, many can lead independent lives. A small number have more serious problems and may not be able to live independently, but with consistent daily teaching and guidance, they can succeed to the best of their abilities. Developmental problems influence the way people think, learn, and behave. Characteristics of a developmental disability are that it is caused by a mental or physical impairment or both, generally can occur before age 18 to 22, and is likely to continue throughout the person's lifetime. The disability results in functional limitation in 3 or more of the following activities of daily living: self-care, use of language, learning, mobility, self-direction, independent living, and economic self-sufficiency. Well, what causes developmental disabilities? There are hundreds of known causes of developmental disabilities as well as many unknown causes. Developmental disabilities can affect physical function or mental function or both. Developmental disabilities can occur before birth, during birth, or after birth, before ages 18 to 22. Before birth, some of the causes of developmental disabilities can include genetics. Some of the most common genetic disorders might include Down syndrome, Fragile X syndrome, Prader-Willi, and Angelman syndromes. Another cause of developmental disability before birth could be fetal alcohol syndrome, and in fact this is the #1 cause of developmental disabilities before birth. Fetal alcohol syndrome is related to excessive ingestion of alcohol during pregnancy, especially during the critical first trimester when neural development of the fetus occurs. Medications taken by the mother before birth can also be a cause of developmental disabilities. And these medications can even include over-the-counter medications, and often physicians will not prescribe medication during that first trimester for the simple reason that it could cause a disability in the child. Yet another cause of developmental disability before birth could be poor nutrition of the mother. So good prenatal diet is very important. And finally, another cause before birth could be infections that the mother may have, such as rubella, which is also known as German measles. Rubella can cause significant defects in the developing fetus. That is why it's so important for the mother's immunization to be up to date before pregnancy. During birth, developmental disabilities can be caused by trauma during the actual birth process, whether during labor or delivery. Anoxia, or lack of oxygen, can also be a cause of the disability during birth. After birth, developmental disabilities can be caused by lead poisoning, or chemical ingestion, or even some medications. Trauma and accidents such as head injuries, child abuse, or drowning can also contribute to developmental disabilities after birth. And then there's a whole group of infections that could occur after birth, such as meningitis, encephalitis, or measles, a common childhood disease which could be prevented with timely immunizations. Developmental disabilities are caused by many conditions that affect the way a person thinks, learns, and behaves. Developmental disabilities can be very mild, or they can be severe. These conditions occur before, during, and after birth. And many of the causes of developmental disabilities can be prevented. Preventable forms of developmental disabilities can occur before birth, during birth, and after birth. Ways to prevent developmental disabilities before birth can include immunization of the mother prior to pregnancy. Good prenatal care can also prevent many forms of developmental disabilities, especially those related to premature births, improper nutrition of the mother, medication, alcohol, or drugs taken by the mother during pregnancy. During birth, good prenatal evaluation and the availability of emergency equipment during the birth process can prevent trauma and lack of oxygen during that birth process. After birth, immunization can prevent many infections that can cause developmental disabilities. So it's very important that immunizations be given in a timely manner. Preventing child abuse through parental education and counseling can prevent some of the traumatic causes of developmental disabilities. Poisonings from lead or household chemicals and medications can be prevented by removing these items from the child's environment and childproofing the home. Head injuries can be prevented by using appropriate child seats correctly placed in cars and wearing helmets for bike riding and other sports. The Americans with Disabilities Act, or ADA, guarantees